I hear our president talking about reopening the economy. I wonder who is going to care for the children of the workers, because I don't think a lot of people know how fragile is our situation at this point.
Protocols have totally changed because social distancing with young children is very, very hard.
First of all, in order to open and adhere to the CDC guidelines, we have to have the proper PPE.
We had to get gowns, we had to get masks, we had to get hair covers, shoe covers.
Every 5 to 10, I'm wiping down a chair. I'm wiping down a table. They're washing their hands. I'm Lysol in the bottom of their shoes when they come in.
A classroom that once served 24 children will now only be able to serve 10 children. So what happens to the other 14 kids?
What's going to happen if someone gets sick? You have to shut down for 14 days. So then you start all over again.
We had 72 to 80 employees on staff pre-corona, and right now we've got 20.
I hope to stay in business, but the way childcare is going, who knows? We really don't know at this time.
Children cannot learn optimally unless they feel secure and welcomed and loved. And I want to make sure that we can provide that to them without them feeling that they can't be, hugged if they need their hug.
The right thing to do is to support the industry so they don't have to make a decision that compromises safety.
What I would love for federal and state policymakers to see and know and recognize is that our child care provider workforce is the backbone of the economy in our country.
If there's one thing about people that are in the early childhood education field, it's that they're pretty fearless, and they will do whatever it takes to make sure that child and that family gets what they need. So that part makes me hopeful.
Welcome, everyone. We're so thrilled to be here with 3 amazing panelists where we can talk about what we've just seen with this amazing documentary, No Small Matter, about how critical it is to have high quality early care and learning universally available to all of our children, how critical it is for families, how important it is we have an excellent system, and how far we have to go to get there and how we get there. Hopefully we'll be talking about that and giving everyone energy and action items for how we move forward with this really critical issue. So joining us tonight for this conversation, we have Dr. Renee Boynton-Jarrett. She's a practicing primary care physician at Boston Medical Center, a social epidemiologist, and the founding director of the Vital Village Community Engagement Network. She's also an associate professor of pediatrics at the Boston University Medical School, where her work focuses on the role of early life adversities and the social determinants of health and equity. We have Reggie Beca here. He's the executive director of Shine Early Learning. He's a social worker. He previously served as the executive director of the Colorado Department of Human Services, and he was an Aspen Institute Ascend Fellow, focusing on 2-generation approaches to move children and families beyond poverty. And we have Amanda Perez. She's the senior advocacy manager at 0 to 3, an organization whose mission is to ensure that all babies and toddlers have a strong start in life. And she's a former infant and toddler teacher herself, and became an advocate to really help change the world. So Amanda, let's start with you. We've just seen this really heartbreaking video from providers talking about, here we have a very broken system, a very fragile early care and learning system. And this global coronavirus pandemic is just really pushing it to the point of crisis. What can you tell us about what you're hearing from parents and caregivers and early education teachers on the field? What's happening?
Yeah, so Brigid, in my role, I'm really able to talk with a lot of caregivers and providers who are really talking with us about the experience of being in childcare right now. And we know, as they said in the video, that about a third of providers have now lost their jobs. We're very concerned about that group. very early in this crisis, NACY found, the National Association for the Education of Young Children, found that like 50% of those providers only had about 2 weeks that they felt like they could go in the pandemic before they were going to need to really get some investment from the federal government. We know that those providers are struggling, and they're struggling on a really individual level, as you said, because there's such a they're so often so sorely underpaid, and they are not valued the way that they should be. They often do not have the benefits that folks require. I was telling you earlier that I had my first job as a childcare provider when I came out of college, and I did not make a living wage, and I was very short time in that field, even though I loved it. So we really have to recognize the gift that those providers are giving us and to families, and what it costs for them to do that in a variety of different ways. One of the providers that we spoke with said to us, I'm a businesswoman. I planned for rainy days. I did not plan for a rainy month. And I think that is such a profoundly important thing to be sharing. I have another provider who talked to me a little bit about wellness, and we're very concerned about sort of the kinds of things that providers are going back into. They often have to stay open because that's the income for their family.
Yeah.
There's a pandemic going on. They're extremely concerned about their health and well-being and the health and well-being of their families, particularly when children are coming into their homes, as they frequently are for family child care providers. There may or may not be protective equipment available to them. They often don't have the supplies that they need. I had a family child care provider tell me that she had a quota for the amount of milk that she could buy. And so she gave that milk to the families that she was serving in her child care situation, but she wasn't able to feed her own child the milk, and her daughter was crying for that milk. It was the first experience that she ever had like that. Angela from Arizona said, I am a small group home child care provider with 5 children in my care full time. I depend on the full-time care I give to support my family. I have lost families due to the loss of jobs, as we might imagine, and that impacts how I can support my own family during this time. I have fears every day of how to keep my family safe from the outside virus coming into my home, but I need to continue so that I can still pay my bills and feed my own family. And I think that piece of like where providers are really standing in the nexus of all of this is really profoundly important as we think about how to support them.
Yeah, you had said that when you were an infant and toddler teacher, barely making ends meet. And now, even without that really incredibly low pay, you talk about it almost being a gift. Well, this is very valuable work that deserves decent and dignified pay and to be a good job. Dr. Boynton-Jarrett, I'd like to let's turn to you next. What are you seeing? Just looking largely at the coronavirus, how it's impacting families across the board. Not only caregivers and their families. Many of them have young children that they need to care for as well. But the families who rely on early care and learning. What are you seeing?
So what we know about COVID-19 is an unfortunate but typical story that across the board, Indigenous communities and people of color are disproportionately affected. So their neighborhoods, your health is impacted by where you live, learn, work, and play. So we see higher rates on reservations and in neighborhoods that are more predominantly communities of color or racial ethnic minorities. We see higher rates, 5 times the infection rate among Native Americans, African Americans, and 4 times the infection rate among Latinx communities in comparison to Caucasian. We're seeing higher rates of hospitalization, and tragically, we are seeing extremely high rates of mortality. So there's a disproportionate burden. And where is that coming from? We know that communities that are marginalized socially in any way are at disproportionate risk for a harsher impact in any epidemic. Why is that the case? Well, let's think about working conditions. Who actually are the essential workers? What kind of benefits and leave and protections do they have? who was the first of the essential workers to get access to protective equipment? So
Mm.
when we think about our one group of essential workers that's been largely invisible, childcare providers, essential workers that were needed, but did not have access to PPE or a systematic infrastructure for testing, screening, treatment, and data collection. And so those factors, we also have living conditions that differ in terms of residential segregation, lack of a wealth base, all
Mhm.
sorts of factors. Then we have health inequities as well. So you can see systematically why the cards would be stacked against communities of color and indigenous communities, a disproportionate number of whom are essential workers are women and women of color. They also happen to be small business owners, which was another community disproportionately affected by this epidemic. So thinking of Amanda's stories, the stories that families are sharing, we can see these patterns across the population repeating this same tragedy, and that could have been prevented had we had alternative systems and structures in place, appropriate structure that would have been protective for childcare workers and providers, as well as the families that they are caring for during this time.
Well, I want to get into that, and because I want us to move into what do we do and what are those alternative structures that we need to be building? How do we emerge from this better? But let me turn to you, Reggie, at this point. When we were talking earlier, you'd said, this is a devastating pandemic, and certainly devastating disproportionately on communities of color, but that at some point it's going to end. And yet we are still struggling with a very fragile and broken system. Talk about from your point of view, where, what are you seeing, and what do we really need to be thinking about next?
But you laid it out so beautifully, Brigid, that in my view, the pandemic has taken a system that has been fragile at getting more children, particularly children from low-income families, into high-quality early learning environments, and has really challenged a fragile system. But the good news is we know that one day, and hopefully not too far off, the pandemic will be behind us. And we know that Congress over the last several months has made significant investments through states primarily into the child care block grant and other strategies to assist the child care industry. I think that states have an opportunity to invest those dollars wisely and to do so in a way that is thinking about what we want our system to look like a year from now or 2 years from now, and make certain that we are making policy and budgetary investments that will be the proper stepping stones to get us to the system as we want it to be on the other side of this pandemic.
When you're talking about, Amanda, I wanted to go back to you. We were talking about what we need, to build this better system, some of the points that Reggie's making. And so much of what the film was about was the importance of quality early care and education. So Amanda, can you talk a little bit about why that's so important and why it costs so much and why that's a cost that we should be willing to bear?
Yeah, I mean, I think the film is really lovely in the way that it describes the brain development that happens in those early years, the foundational, rapid brain development. And so when we think about childcare, it is not just a place that we stash children while families work. It has to be a learning environment where people are really coming in and stimulating babies and really thinking, sort of helping them grow and learn and explore and do all the things that are so important for them to do. That requires, for infants and toddlers in particular, that requires low ratios of caregivers to children. We can't have more than probably 1 to 4. And I know that different states are different on sort of how that rolls out, but we have to be thinking about that relationship as those babies are expressing themselves in ways that caregivers need to be really tuned into and sort of develop those relationships in a really nonverbal way so that babies are familiar and caregivers really understand what it is that these young babies are telling them, that toddlers are telling them. It's such a process, right? For all of us who know babies, we know that those of us that fall in love with them know them best, right? So we really want to make sure that babies have that, because as Matthew Melmed says in the film, that is really the key to learning, that kind of relationship that happens. And I know as Reggie's describing his program, you can kind of picture it there, right? Like those caregivers of really nurturing those babies and really stimulating them. We've got to be thinking about materials. We've got to be thinking about absolutely safe and appropriate environments. When we're thinking in COVID, we have to be thinking, Renee, as you said, about PPE. We have to be thinking about sort of all of the elements that come in to care for a baby and really nurture that baby during that time, or for older children, for preschoolers as well. So it is a huge undertaking to make sure that all of those regulations are a part of what's happening, to make sure that what we know about child development and what we know about family support as well is really happening within that environment. And it costs money. It cannot all be borne on the backs of families. It needs that public investment for sure.
Well, it's so important that you mentioned that. When we were talking earlier, you were saying that, when you look at who pays for childcare, who pays for the early care and learning, parents pay for the majority of it. And as the film pointed out, and there's been great research that shows it's more expensive to put an infant into a high quality childcare than it does to put an 18-year-old through public university. And having just had a son graduate from, it was an out-of-state public university, that is a lot of money. That is a lot to put onto young parents. And Reggie, you were talking about how important it is that, that there has been this investment, from the federal government in the CARES package. But, to be perfectly honest, so I think it was $3 billion in the first CARES Act. Well, the airlines, I've got tens of billions. And, in the loans to small businesses, so many early care and learning providers were left out of that. They didn't have the systems, they didn't have the bookkeepers, they didn't have the connections, and so they're really left out in the cold. We've got one question coming in from our Facebook Live feed. It's like, how can we ensure that the educators who are putting themselves at risk, how can we ensure that they're properly compensated? How can we ensure pay equity? And to Amanda's point, how can we move beyond really subsidizing the system on the backs of parents who are strapped and caregivers who are earning poverty wages? Reggie, what do we do?
Thank you. Thanks for giving me the easy question.
I'm going to Renee next.
So. I will be the last person to argue that more public money should be invested in early learning. They absolutely should be. At the same time, I recognize that we have $3 billion new dollars coming in from federal resources to states. And I think there was a second revenue package in another one of the stimulus bills that will be new dollars that are available to states to make investments. The question that I would have is, how are we going to make those investments at the state and local level? Some states have said, well, I have to give all childcare providers, regardless of quality, regardless of which children they serve, regardless of where they serve those children, we're just going to give everybody some money to keep them whole. Well, there's a missed opportunity. What if we're giving resources to providers who are serving low-income kids in higher quality? Or we make funds available using those public dollars so that those childcare programs could make investments in the environments, in the teachers that are in the classroom, in their curriculum, in their data management systems, in all of the pieces that would be so critical to help move their systems forward. What if we made investments strategically thinking about equity and addressing things like childcare deserts, where we know that there's a need, a population of young children, but there's no high quality childcare or affordable high quality childcare available? What if we made strategic investments in that way? $3 billion may not be as much as the airline industry is getting, but there's also a chance for us to use those dollars wisely to propel the system through this pandemic and hopefully be in a better position on the other side.
You know, Renee, let me go to you. You were nodding and shaking your head vigorously at different points.
I hope it was up and down and not sideways.
You know, but you had also talked earlier about the need for alternative systems, alternative structures. And how do we emerge better and more equitable? So I'd love for you, let me pose that to you. What do we do? How do we emerge better and more equitable?
We've arrived at a reckoning. We've arrived at a reckoning. Let's admit it. We have undervalued childcare providers. The average pay was a little over $11 in 2018 for the average childcare center provider. We've undervalued them. We've underinvested in their professional development, their training, and the robustness of their systems. At the same point in time, one thing that has become very obvious during our quarantine period is that in order to reopen the economy, we actually need our childcare, right? So these two things are inextricably linked. So we have the opportunity to build back better. We absolutely have that opportunity, but what are the decisions that we need to make that have been alluded to by my colleagues here on the panel already? We need to make decisions around investment. I don't believe that we don't know what high quality childcare looks like. We know what that looks like. Have we made a decision that that should be universally accessible? Thinking about childcare providers, many of whom don't have health insurance, but at the same time are frontline essential workers during this pandemic. Are we going to make the decision to invest in ensuring their health and the health of their families and the health of the children that they're caring for? Are we going to provide them with resources around mental health? Think about the weight of what they are addressing right now, the collective trauma, ambiguity, uncertainty that we are all facing, and they're at the front lines needing to be available and accessible for that powerful brain development, that powerful emotional connection, that powerful investment in those early childhood moments and years. So investing in their care, investing in their mental well-being, investing in their basic human right to health insurance are all part of building back better, making sure they have appropriate resources, protocols, and plans. This is going to require us to work across systems: business, healthcare, public health, social service, and childcare should be aligned and working together so that we can build the infrastructure that's needed to really support us through this pandemic, not just to survive it, but to thrive in it. And the truth be told, we're not equitably surviving it. Mm-hmm. And there is a disproportionate burden being faced by low-income families, communities of color, and Indigenous communities, the workers, and the children. So we have to face that. And it is not by chance that we are having a nation of protest, civic engagement, and a focus on structural racism right now in the midst of this pandemic. It is not random. This is all a reckoning that we have the opportunity, and perhaps now we also have the public will. So let's not forget about children. Let's invest in children and those who care for children.
Well, so you're
Boynton-Jarrett,
go ahead.
I just
Reggie.
wanted to say,
Yeah.
That was so awesome what you said, and it made me think about one of the things I loved doing when I worked in state government was getting rid of unnecessary regulations. And a crisis is almost no better time to deal with regulations that simply get in the way. One of them that we had in Colorado when I was there, Valley Settlement Project in the western side of Colorado, served migrant families. And they had this unique strategy where they would remodel a bus into an early childhood classroom and take the school bus to the migrant communities with a master's level teacher to teach these kids. But the buses didn't meet our regulatory requirements. And so we were telling them they had to stop this fantastic program of bringing education to children. Well, wisely, that made it to the state capitol. We changed the regulations to make that a possibility. Those are the types of opportunities that we can take on now and think about, do we have regulations that are actually prohibiting us from, and prohibiting providers from making the investments that they want to make for young children.
Mm.
Well, and at the same time, though, Reggie, I mean, I think we do have to pay a lot of attention to those regulations. One of my huge concerns is that as we come out of this and we're trying to make childcare more affordable for families, because without sort of making that important public investment, we're going to get rid of those regulations that are so protective often of babies, toddlers, families, young children, all of that. And for caregivers too, as we're thinking about their health and development. So there's the analysis that has to happen. Is this something that is actually useful? Is it actually providing an important level of support for the folks in the system, or is it something that we can do away with because it doesn't make sense in this environment?
And I would just add to that, we often miss a crucial stakeholder in these decisions. Caregivers and providers are not being brought to the table to weigh in on these decisions and to help inform the structure of these policies. It's a missed opportunity.
Who knows better what's needed in a classroom or in a setting than the people who actually work there? So yeah, definitely a plug for human-centered design. That's the only way to go. Bring in the voices of the people and the expertise who really know, because they have that experience. But Renee, if I could go back to you, you were talking about, you're all talking about how this is an opportunity, this is a crisis, and there's opportunity for renewed civic engagement, for political will, and we're all talking about the need for investment, some rather substantial investment, and as Reggie pointed out, there has been $3 billion, in one of the early care packages. There are others who have called for 50 billion, but it hasn't really gone anywhere, in Congress. How are we going to get to that point of really finally getting the action from policymakers, really building on that political will to understand this is something that is incredibly valuable in the current moment with COVID, after COVID, for the future of the country? How do we make that connection for people to really understand that this is not about a boondoggle public expense, but a real valuable investment in the future of this country?
I think one thing that COVID-19 has taught us, if we didn't know before, our fates are inextricably linked. So yes, there are disparities and differences in how COVID-19 is affecting communities, but this infectious illness is infectious and airborne, and we rely on each other. We rely on essential workers to care for us, to care for our children, to provide us with the food we need. We are all inextricably connected. So let's be comprehensive. Let's take care of everyone so we can all get through this time and actually emerge from this with an economy that can thrive, with children who have had the enrichment that they need to be successful later on in life, and with families that are not economically and emotionally shattered by the experiences. We can make those decisions, and I think that we have the public momentum right now to start articulating those decisions together. Those of us here at the table, we have to listen to communities, to those on the front lines better than we have in the past. And we have to be in communication with our government in a different set of ways. But there are bright spots that are out there, and there have been innovations that have already shown some success. I think data is important. We need to look at what places have been doing better than we would have predicted, and what are they doing? What are the policies that have been in place? What are ways communities have organized? And what can we learn from success? And really try to scale that and grow that. So we have to be curious.
I love that. We've got about 1 minute left. What I'd love to ask each of you is, for the people who are watching this, who just watched this documentary, who've gotten all fired up like I did after I watched it, what's one thing that they should go out and do? What's, 1 to 2 things to kind of build on this momentum, to build on this moment, to make that change? Amanda, let's start with you.
Yeah, so I would say it is absolutely time to act. And I know folks hear that all the time, that it's that they have to go out and they have to talk to the government. It is not sexy. It is not sort of what you did yesterday, but it is also not difficult. For those of you who are caregivers, Congress is asking for your stories. For those of you who are families, Congress needs to hear your thoughts about childcare. For so long, caregivers and families have been pitted against each other because they are trying to, one of them is trying to get paid for the good work that they're doing, and someone else has to pay that money in, and so it's a lot of conflict. Now is the time. If you all want to get involved, go to thinkbabies.org, thinkbabies.org. We've got simple things that you can do, but everybody has an opportunity to act, and I'm asking folks to do that now.
Reggie?
When you know better, do better. We have more than 50 years of research that tell us children, particularly kids from low-income families who have access to high-quality childcare, do better in life. You just heard a great documentary proving that argument. We know better. Let's begin to make the investments and make the hard decisions, policy decisions, that is going to result in more kids getting access to high-quality care. And doing so by investing in those child care providers who are serving those populations and who want to invest in their small businesses. One of the strategies we have at Shine Early Learning is a project we started in Indiana where we're providing training and technical assistance to child care providers in the state, but using 21st century approaches of virtual technologies, virtual coaching, and other strategies that's much more cost effective, we believe, and can get providers the information in the way that they need at the time that they need it, that's going to be most effective at helping them serve children in that state.
All right. And Renee, the last word.
Every vote makes a difference. One vote makes a difference. One voice makes a difference. We need to expand our circle of compassion and raise our voices to work together collaboratively and differently. We've come to a reckoning at this point in time, and I don't think equity takes us far enough. We have to think about dignity. We have to think about the dignity of every person, our shared humanity, and the dignity of every child. And if we set dignity as our goal, I know we'll do the right thing.
I love that. Well, thank you to all of the panelists for joining us tonight. I want to remind everyone that No Small Matter will be available to rent or buy starting tomorrow. So go to nosmallmatter.com for more details and to spread the message about the film. Remember that there is going to be another film from politicians following this. So again, many thanks to Amanda, to Reggie, to Renee, to the makers of the documentary. Thank you so much and good night.